Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Whit Hall. He is a neonatologist and a professor at UAMS and Arkansas Children's Hospital. Dr. Hall, thank you for being here.
Well, thanks for the invitation. I appreciate your asking me to do this and shedding light on what I think is a very important subject.
Well, let's dive in. So what motivated you as a physician and community member to get involved in conversations about gun violence prevention?
Sure. Basically, I'm a neonatologist, which means that after your belly button heals up, I don't know anything. But I got involved. You know, Robin, I've been a hunter for 70 years. I've been a pediatrician for 50 years. And 3 years ago, on July 1st, 2022, my grandson Isaiah was shot and killed in a random act of gun violence that occurred at the Walmart out at Chenal. So that has really spurred my interest in how can we stem this epidemic of gun violence. You know, as a pediatrician, the number one killer of children now is guns. So I think that we all have to take a very careful look at what is important in the lives of our children. And there are two things that happen to children with guns. One is homicide, and that's much more common, for example, relatively speaking, among the Black community. African Americans have a much higher rate of homicide, for example, than the white community. On the other hand, suicide is also very common. And that's more common in the white community. Actually, it's more common in my demographics, which are older white men. And so there's been a lot of effort toward trying to stem the tide of both of those things that we deal with in gun violence.
And as someone who has dedicated their career telling or caring for children, how do you view gun violence through a public health lens?
Well, as we stated, there are a couple of things I think that are important from a public health perspective. Number one, I think it's important to understand that, as we stated previously, it's the number one killer of children. It's more common than pneumonia. It's more common. Cancer is number 3. In 2017, because of a lot of work done by the National Highway Transportation Agency, the incidence of gun violence exceeded the incidence of death due to automobile accidents. That was previously number 1. Previously, in the 1970s, the incidence of death due to automobile accidents was about 13 per 100,000. It has decreased in the meantime to around 7 per 100,000. So it's basically been cut in half. On the other hand, the incidence of death due to gun violence was around 2 to 3 per 100,000, and it's increased to over almost 9 per 100,000 kids. So from a public health perspective, it's something that we really need to focus all our efforts on. Why spend so much money on cancer when that's the number 3 killer? We need to spend more money in research and in trying to implement programs that help stem the gun violence epidemic.
And from your experience in medicine, what kind of impacts, physical, emotional, long-term, does gun violence have on children, families, and communities?
I'll give you my own personal story. When I saw my grandson, Isaiah, he was a virile, handsome young man, 18 years old. And when I saw him in that casket, he was cold and hard, and that life had been stolen from him by a 19-year-old that had gotten a brand new handgun without any training, without any understanding, I don't think, of what he did. There was not a dry eye at the funeral where he was. They say that gun violence affects 200 people. One death in gun violence affects as many as 200 people. There were certainly more than that at his service. And I think that all of his teachers were there, and it was so traumatic for his teachers. He's had 5 brothers and sisters. It was traumatic for them. It was traumatic for his cousins. I've got 18 grandchildren, and so every single one of them knew Isaiah. So I think that, when you think about how much it affects a community, I think that we all have to think very, very hard about how we can prevent some of these deaths. That death could have easily been prevented.
And how does gun violence show up in hospital and clinical settings, particularly for pediatric care?
Boy, that's a great question, and I'm so glad you asked it, because I think that healthcare providers have a unique opportunity. And the opportunity, there have been five big communities and cities, Baltimore, Chicago, Los Angeles, that have really decreased the incidence of death due to homicide. And basically the way that they did it was to involve the community and involve the healthcare providers. The healthcare providers were able to identify victims of gun violence and their families. And that's very important, because what happens so frequently is that there is retaliation, particularly with gang violence, or even with just personal, with gangs may or may not be involved, but there is oftentimes retaliation. And so identifying those relatives and friends of gun violence victims, and then providing services for them so that they don't go out and do the same thing. And then that really is something that can be broadcast throughout a community. And there are several things that have come to the front with research. One of the things that I think is very interesting is that so often the communities where gun violence occurs is actually a very small geographical area. So that means that if we do the research, if the communities do the research and identify exactly where these deaths are occurring, and oftentimes it's only in a 3 or 4 block area, we can concentrate our resources, and the resources would include social services resources, job people, working to help increase the jobs, increase the economics, because these are all underlying social drivers of gun violence. The other thing that's a social driver is suicide. Once a child commits suicide, that tends to, many people think about that, and where they may not think about it previously, that sort of spurs their interest in doing that. And so there's a lot of things that can be done from a community perspective. The healthcare providers, for example, are extremely important with suicide, because they need to identify a kid that may be depressed. And it is very important to ask kids, have you ever thought about suicide? That's kind of a level 1. If they've just thought about it, but it was fleeting, that's not very important. If they've thought about it and think about it a lot, that's a higher level, and that would require some intervention. The specific intervention would be a mental health care provider. The third thing that we worry about is if they say, yes, I've thought about it and I've actually got a plan for it, then that means they need to go to an emergency room or immediately to a healthcare provider, because that child is in grave danger. How can we prevent that? Well, there's a lot of things that we can do, and of course we talked about mental health. Most of the kids that commit suicide, and most of the kids that are involved in homicide, and in Isaiah's case, my grandson's case, this kid he never would have been identified, other than he was young, as being somebody who was at risk to kill somebody. But if we can identify them, and then we can take the guns away, or at least take the guns and lock them up.
And how can families and educators do better to identify and support youth who may be struggling? Because it's not just in the physician's hands.
Sure. The physicians, I think, the main thing that physicians can do is ask about depression, particularly in adolescents. Adolescents, those who survive a suicide attempt, obviously those that are successful, we don't know. But typically, they think about it for about 30 minutes or less. So if somebody gets jilted by their girlfriend or boyfriend, and all of these hormones are raging through their body, they're dealing with puberty and all the issues that come with that, and then they suddenly decide that they want to end their life, and they think about it for a very short period of time. Having those guns locked up is very important, just to give some time for them to think about it. Now, if somebody's bound and determined to do it, then that may not be successful, but it can be successful in preventing a suicide oftentimes. And the same thing goes with homicide. If a parent identifies a kid that is angry, or they've been, they had a friend who's been shot, or have a friend that's been beat up or bullied or whatever, keeping that gun locked up is extremely important.
And from a public health standpoint, what do the numbers tell us about youth and gun-related injuries? You've touched on that a little bit.
Sure. Well, I think that from a public health standpoint, I think that one of the things that we really need to think about, we've got more guns than people in this country. We've got more guns than any other country, I believe, except maybe Israel. And so how's that working for you? We have 26 times the amount of gun violence as the other industrialized countries in the world. So given the fact that we've got more guns than people, and we have 26 times, that's huge, 26 times the rate of gun violence deaths as other industrialized nations, we can do better than that. We must do better than that.
And how can we empower communities to take ownership of safety in ways that feel supportive and not divisive?
Well, I think it's not political. I think we all need to realize that this is not a political situation. This is something that affects all of us. And we need to take the politics out of it. This is not a red thing or a blue thing. This is something that has to do with gun safety. Nobody wants to take your guns away. I'm a member of Moms Demand Action. We're not interested in taking guns away unless somebody is at risk to hurt themselves or others.
And what message do you hope to share with families who may have experienced loss or trauma? What should they look for? What can they do?
Well, first of all, the trauma stays with them. It's really tough. I think that there are many things that people can do, and I think talking to a mental health counselor is very helpful. Greg Adams has he has a program at Arkansas Children's Hospital called Good Morning, MOURNING, and he and his team have done a wonderful job working with kids who have had relatives or others that either die from gun violence or from any other cause. And so the grieving process takes a long time. Typically, it takes 2 to 3 months before people quit thinking about it every day, and it takes a year before they settle down a little bit. But we don't ever get over it. I can tell you from a personal standpoint, I've not gotten over my grandson, Isaiah, being shot and killed. So I think that that's something that talking to a mental health counselor would be very helpful. And the other thing, there are many people that are ready, willing, and able to do that. One of the organizations that I work with, Moms Demand Action, works with survivors, and I think that's been very helpful. It was very helpful for me anyway.
And what gives you hope when you think about the future of child safety in Arkansas?
What gives me hope is I think that we're getting more and more people involved in recognizing the lethality of guns and the fact that if we can get this out of the political sphere, as you mentioned earlier, how can we keep this from being divisive and stop this from being a divisive issue? That gives me hope.
And if viewers want to get involved in gun violence prevention in a non-political way, what are some positive steps they can take?
Well, first of all, I think healthcare providers, particularly those that are pediatricians, there is a great from the American Academy of Pediatrics. They have a firearm prevention, what they call a special interest group by the American Academy of Pediatrics. I'm also a member of Moms Demand Action. Both of those groups are highly focused on gun safety. They're not interested in taking anybody's guns away. They're interested in gun safety. I would love to see hunters become more involved, because hunters, I think about in my own circumstance, the person that shot and killed Isaiah, had he been taken hunting, had he had that kind of a relationship with his family, I don't think this ever would have happened. So I think that getting hunters involved is a really great idea. Hunters are also very focused on gun safety. I shot my first gun when I was 4 years old. It was a 12 gauge that my father had, and I remember it knocked the breath out of me. And I got up and did it again. So I think that, but the first thing that I learned was about gun safety. And I think that's what we really, really need to emphasize.
I grew up in rural Arkansas, and one of the core memories that I have of Delott High School was hunter's education class that I took in school, and grew up in a home where my father was an avid hunter. And so I appreciate that and understanding and knowing the safety components of what that means for you and for those around you. Yeah,
I think that's absolutely true. And I think hunters would be great advocates for this, because I can't think of another group except maybe law enforcement and veterans as well. They have been trained about gun safety. So I think that those three groups we really need to engage. Law enforcement is very engaged on gun safety, and we've got a group in Moms Demand Action that is working on a program called Train Smart, which has to do with, if you're going to get a gun, should you get a gun? If you get a gun, what kind should you use? And how do you take care of a gun? So all of those things I think are very important, and particularly important for somebody that wants a gun for protection.
Well, Dr. Hall, thank you so much for not only sharing your personal story and to share Isaiah's legacy and memory, but for the advocacy that you do and relating that to the healthcare community. It's so important. Thank you.
Well, thanks for the invitation.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.